Jayne here. One of the many challenging aspects of having gut and bowel issues is actually knowing what is going on. Why are you experiencing symptoms of pain, bloating, constipation, diarrhea, gas, nausea, and fatigue? What's really happening inside of your body? Are these symptoms due to irritable bowel syndrome, or are they something else, such as inflammatory bowel disease? In this video, I'll be helping you understand the key differences in symptoms between IBS and IBD, and the red flags to look out for and when to seek medical attention. And for those of you who are new to my channel, my name is Jayne, and as a psychotherapist, gut-directed hypnotherapist, and wellness coach, I help people with irritable bowel syndrome beat their symptoms long-term without restrictive diets and without using medication for the rest of their lives. So if you want more content on this topic, then subscribe to my channel and click the bell button as well to be notified when I post new videos every single week. And before I begin, I just want to quickly let you know about my free ultimate guide to IBS gut pain, where I share with you the 5 reasons behind your IBS pain, which you've probably never been told about. You'll find the link to get your copy of this guide just down below in the description box. Now, when it comes to understanding what is happening inside of your bowel, it can get pretty confusing. And I, for one, know what it's like to feel like you're literally banging your head against the wall, trying to get some answers. Now, many people with irritable bowel syndrome are concerned that they have been misdiagnosed. They believe that they have something more sinister or something called inflammatory bowel disease and not IBS. And this is because IBS symptoms can feel so severe. And of course, Google certainly doesn't help. And the fact that these two gut disorders have a similar name also doesn't help the confusion. So let's start with understanding what is IBS. Now, IBS, irritable bowel syndrome, affects between 10 to 15% of the population and is something called a functional disorder. This means that there is no physical or structural damage to your bowel. For example, if you were to somehow shrink yourself down and take a good look around inside your intestines, you would find everything looking pretty normal. Now, the common symptoms of IBS are bloating, gas, abdominal pain, constipation, diarrhea. And the diagnosis of IBS should be made by your doctor, not by self-diagnosis, okay? Now, your doctor will consider the diagnosis of IBS if you have experienced the symptoms of abdominal pain or discomfort, bloating, or a change in bowel habit for more than 6 months. In addition, the diagnosis of IBS is usually only considered if you have abdominal pain that is relieved by passing a stool, or there is altered bowel frequency, for example, constipation or diarrhea, and at least 2 other symptoms from altered stool passage, meaning straining, urgency, or what we call a feeling of incomplete evacuation, abdominal bloating, distension, which basically means visible bloating, tension or hardness in your abdominal area, symptoms made worse by eating, or passing mucus. Now, unfortunately, the diagnosis of IBS is what we call a diagnosis of exclusion, meaning there is no specific test for IBS itself. And the diagnosis is based on what I've already covered, and it also is based on excluding a number of conditions depending on what your symptoms are. Now, the reason there is no test for IBS because, as I mentioned, there is actually no physical damage to the gut. So there's nothing that we can actually test for, at least not at this point in time. So I want you to go ahead and put a 1 in the comments below if you've already got your IBS diagnosed, or a number 2 if you're still looking for some answers. So now we've talked about IBS, let's talk about IBD. What is IBD? Now, IBD stands for inflammatory bowel disease and is a completely different gut disorder from IBS. It is also a lot less common, with estimates of around 1% of the adult population. Now, before I dive into what IBD is, I also want to clear up a very common misunderstanding, and that is thinking that IBS turns into IBD or even colon cancer. This is not true. IBS does not turn into anything dangerous or life-threatening. IBS, as I mentioned, is a very different disorder. Now, with that said, let me explain the 2 different types of inflammatory bowel disease. Crohn's and ulcerative colitis are the two types of IBD, and they are often characterized as autoimmune disorders, which means they develop because the body starts to attack itself, causing inflammation of the GI tract, which is anywhere from your mouth all the way down to your anus. This is a big difference between IBD and IBS, which is not an autoimmune disorder. Also, unlike IBS, Crohn's disease and ulcerative colitis are characterized by inflammation in your gastrointestinal tract. So, for example, with people who have Crohn's disease, they may have ulcers and inflammation anywhere from their mouth, as I mentioned, all the way down their GI tract, including their anus. Now, with ulcerative colitis, however, that inflammation is limited to just the large intestine. Now, it's this inflammation that allows IBD to be diagnosed with tests such as a colonoscopy, as there is actually some physical damage to the bowel that we can see, unlike with IBS. So, how do you know if you have inflammatory bowel disease or IBS? Well, now you know what IBD is and some of the key differences with IBS, let's just talk about some of the symptoms that you need to be aware of and what I call red flags. So let's start with Crohn's disease. Symptoms of Crohn's disease depend on where in the GI tract you have inflammation. It's estimated that half of all people who have Crohn's disease have the disease in both their small intestine and large intestine. Common signs of Crohn's disease are abdominal pain, loose stools, occasional low-grade fevers, fatigue, blood in your stool, and weight loss. In addition, you may also notice inflammation in other seemingly unrelated areas, such as the eyes, experiencing back pain and arthritis, ulcers in the mouth, and also ulcers on the skin. Anemia is also an indication of Crohn's, which can be picked up via a blood test. Now, with ulcerative colitis, the symptoms are very similar, with abdominal pain, loose and or bloody stools, urgency of bowel movement, fatigue, loss of appetite, and weight loss, all pointing to something which needs to be addressed ASAP. These symptoms are not typical of IBS and do require you to see a doctor. So what are the most important red flags? Well, the red flags or warning signs that you really need to be aware of are things such as unintentional and unexplained weight loss, rectal bleeding, which can be seen as blood in your stool in the toilet bowl or blood when wiping, anemia, which can usually be felt when you're running really low on energy and you're feeling fatigue, and again, this can be picked up by a blood test. Also, warning signs include abdominal or rectal lumps, and then the raised inflammatory markers, which are determined by a blood test, but can also be experienced physically, for example, on the skin, such as rashes, or experiences joint pain. These all point to inflammation in the body. And look, I get it. Gut stuff can be really embarrassing and awkward to talk about, and I know it's easier to just want to put your head in the sand and hope your symptoms just go away. But please don't do this. Your body is giving you a very clear sign that all is not okay in your gut, and it is vitally important if that you experience any of those red flags that I've already covered, that you speak to your doctor ASAP, because there is plenty of help out there for you, and by knowing what's really going on in your inside rather than guessing or Googling, you can start to manage your symptoms. Now, if you have been diagnosed with IBS and you are struggling to get your symptoms under control, then I want you to head on over to my website to learn more about the Calm Gut Method, which is a system and an approach which is recommended for even moderate to severe cases of IBS. You can find the link in the description box below. And also, if you want to join a community where you get to ask your questions and actually get advice from myself, then I want you to join me in my free Facebook group. You can join that group by clicking the link below this video in the description. I would love to have you there. In the meantime, leave a comment below this video and share your experiences of getting your gut issues diagnosed. How did you go? What questions do you have? I'd really love to hear from you. And if you found this video helpful, then please make sure you subscribe to my channel and like this video if you want to see more content like this one. And do share this video with anyone you know who is struggling to make sense of their symptoms and unsure of whether they should visit their doctor or not. In the meantime, I will leave you with these 2 other videos with more insights, tips, and strategies to help you start living life on your terms, not your bowels. For now, I will see you in the next video.